My name is Arachu Castro, and I'm a medical anthropologist trained in public health. I was originally a student of anthropology, and I became interested in health issues, and I also have a master's in public health. I have conducted all of my work in Latin America and the Caribbean, and I have worked particularly a lot in Cuba, the Dominican Republic, a bit in Haiti, and in Central America I have worked in Nicaragua, a bit in Honduras, and I've also worked in Peru, Colombia, Venezuela, and Argentina, and I've also done a lot of work in Mexico. I'm new to Tulane. I joined the department in January 2013, and I'm preparing the two courses that I'll be teaching. One is a graduate course on public health in Cuba, which will take place in Havana for 2 weeks. And the other course is an upper-level undergraduate course and also open to master-level students on health and inequality in Latin America. And I'll be starting in the fall. I first traveled to Latin America many years ago. And I was, I'm originally from Spain, and when I first visited Latin America, I was struck by the huge inequality that exists there. And because I was already interested in public health, I saw very clearly that that's where I wanted to work. I have since taken any opportunity I've had to work in Latin America, to have direct experience on the ground, and that's how I've been able to learn even more and to put into practice the different methods that I had studied in the classroom. And I have tried to also spend as much time as possible in different countries, because even if you may think that public health is technical, and it is, as an anthropologist, to me it is very important to understand how people live and how they establish priorities and what are the problems that affect them. So by trying to spend as much time as possible as an anthropologist, I think I have become more effective in working with public officials who work at the Ministry of Public Health to try to work with them research projects that can be helpful to them and that can help improve clinical protocols and health policy and improve health outcomes in the end. Some advice I'd give to students is first to learn as many skill sets in the classroom as possible. Later on, when you're engaged in real-life projects, you may not have the time or patience to start to learn a new methodology. And the second big piece of advice that I give to students is to gain field experience as soon as possible and to become involved in projects either with faculty or with program managers who work outside the university, but not to pretend to do the whole thing by oneself, but maybe to tag along what other people are doing, and again to gain as much direct experience as possible. It's the best way to learn why those skill sets were important in the first place.